everyone. Welcome to this meeting of the Health and Wellbeing Board. I'm Councillor Graham Bridgman and I chair the board. Before we start, let's just explain that the meeting is being held in a hybrid format for those who are watching on YouTube. That is, we have some of the members of the board in the chamber, a precisely neat and tidy quorum, in order that any of the votes that we take, and those votes will be taken in this council chamber, are legitimate, and a whole host of other members of the board joining us via Zoom. So I'm joined in the chamber by councillors Lynn Doherty and Martha Vickers, and by Joe Reeves, who is representing the CCG, and we have to have a representative of the CCG and a representative of the council in the chamber to make it quorate. So thank you, Joe. Other members and substitutes attending remotely. Well, I think what I'll do is I won't go through them individually, but if when they want to speak, they introduce themselves, that would be helpful for everyone. Also want to welcome a few others, and I'm just going to switch my view to gallery so I can see who's here, make sure that I'm not speaking to anyone who isn't here. So we have, or will have, joining us, Nikki Cartwright, Mano Kukarada, I hope I've pronounced that correctly, Michelle Pace, Sarah Rayfield, Maria Shepherd, Ian Woolf, and Leslie Wyman. So we'll come to each of you if you're here, as we need to. Now, those in the chain, let me explain, because we had the announcement from government yesterday, and clearly there is an imperative from Monday, although we would obviously seek to adopt procedures early to work from home. This board is constituted as a committee of the council. That's a statutory basis for this board. And as a committee of the council, we can only make legitimate decisions if we have at least a quorum in a physical room together physically. So that's what we've got in the chamber. And that will, until the government changes the rules, that's going to be what's going to have to happen for all council, committee and other meetings going forward. We are, however, as we have been for many a long time, sitting socially distanced in the chamber, and that obviously means that we can remove our face masks when seated. The other two people I should mention is that Gordon Oliver, apologies to Gordon, is clerking the meeting, and Jack Karimi is the Zoom host. Let's just get rid of that feedback. Thank you. So only board members in the room will be entitled to vote actually on anything, but what I will do is take an indicative vote of members of the board before we take any formal vote in the council chamber. So if I could ask everyone, that includes those in the council chamber, to vote by using your Zoom hand when I ask you to, that would be helpful. There is, this being a Thursday and this being West Berkshire Council, going to be a fire alarm and a lockdown alarm at 10 o'clock. So if we're speaking from the chamber, we'll probably have to mute for a moment, let that happen, and then come back in again. So let us start by asking the clerk if we've had any apologies.
Yes, Chairman, we've had apologies from Councillor Dominic Bowick, and Councillor Vic Jones is substituting, from Matthew Hensby, Paul Illman, Jessica Chandu Evans, Andy Sharp and Katie Summers, and Jill Reeves is substituting. Okay, so those who were present for the meeting held on the 30th of September, you have minutes of that meeting in your agenda pack. Can I ask whether anyone wants to propose any amendments? Stick your Zoom hand up if there's any amendments to be made. No, so I will take that the members virtual and physical agree the minutes. So I will ask those in the chamber to vote in favour or not of the minutes. Those in favour of agreeing the minutes? You can still vote. I've checked this with the monitoring officer, and it doesn't matter whether you were in the room or not. You can still propose second the man vote on them, apparently. So there you go. So those are agreed, and there is a signed copy for Gordon.
Right. Next, let us look at actions arising, and they are in your pack. Bear with me while I turn the page up. So, the comments I will make from the chair, and as usual, Gordon has assisted me by giving me a list. 153, that is on hold until 2022. We've discussed that before. 160, phase 2 of the COVID recovery dashboard tracker is still outstanding. 165, the transition between children's and adult mental health is going to be addressed when we come to the delivery plan. 166, the inequalities task force is continuing to engage with the prior to April ICP, post-April PBP inequalities board. For those watching, this is the interesting acronyms that the NHS use. So PBP is the place-based partnership, also known as Berkshire West. 168, initial discussions have taken place around data for the recovery dashboard, but they're still ongoing and yet to be concluded. 169, one of the things we do need to deal with is the engagement group and having an engagement group chairman. This was discussed at the board steering group and is an ongoing question. 174, management of priority 2 of the strategy is going to be picked up when we review the steering group terms of reference. 175, we've got quick wins identified in the delivery plan, and the timescales will be confirmed when this is all put into project management software, and that's something we'll no doubt discuss when we come to the delivery plan. 176, we're awaiting feedback about comms from Berkshire West, and 177, the defibrillator report is on hold due to work pressures, and that hasn't been assisted, I suspect, by the most recent government announcements. So let me now see whether members have any particular items they want to pick up and discuss. I'll start with Councillor Stewart. I do apologise, Councillor Stewart. Councillor Vickers, I apologise. Microphone.
Right, that's on. Thank you. Sorry, I don't come into the chamber very often, so it still seems strange even after all this time. Yeah, about 177, the councillor who put forward the motion, which has resulted in this being on our action plan, has asked whether you have the information, i.e. a map of where defibrillators are throughout the district. I think this is going to be looked at by Matt Pearce. So if you haven't, he's happy to help with that information. So he asked me to put that forward. Okay.
Well, I'll let Matt come back on that, but I suspect that will be an offer he will accept.
Yeah, unfortunately, Councillor Vickers, obviously we're a bit preoccupied with other matters with regards to COVID this time. So any help would be gratefully appreciated. So happy to take him up on that offer. Thank you.
Thank you.
So, members, are there any other points on the action plan from the previous meeting? I see no one wanting to speak, so we'll move on. So we now have declarations of interest over and above the standard ones which are in the agenda pack. So does anyone have any particular declarations they want to make us aware of now? No, fine, we move on. So public questions. We have had 3 questions from members of the public, and I thank them for asking their questions. They are both the questioners are joining remotely to have their questions answered. So we have 2 from Karen Swaffield and 1 from Paula Saunderson. So if we can go to they are all to the portfolio holder for adult social care. So Councillor Stewart will be answering. So I'll leave Councillor Stewart to answer the questions which have been put up. Oh, I do apologise. Of course, I'm looking at the agenda pack. I do apologise for that. The first two questions were laid down. I apologise to Councillor Stewart for worrying her. Were laid down for the portfolio holder for adult social care, but on further reflection, they were actually decided as questions for the portfolio holder for children and young people in education. That's Councillor Bowick. Councillor Bowick, of course, hasn't been able to join us. So I was going to answer those questions. And now all I've got to do is find the answers. So bear with me for a moment because I know I've got them. And as you might anticipate, this will be me reading out answers that I have been given by officers. So to the extent that there are any follow-up questions, it's going to be a little question. Right, thank you. And thank you, Gordon, for helping me out. So in answer to the first question, there were 85 children currently in temporary accommodation. 32 of those in temporary accommodation have children. So that's 32 of the 49 temporary accommodation households. So there's a difference, obviously, between the number of children in temporary accommodation, number of households. And 32 out of the 49 have children. So that is 65% of the households have children. We can't produce ward data. That isn't currently available. The statistics aren't broken down by ward. But in terms of a trend, the trend is for more household approaches for 2-bedroom homes. So that is the specific answer to the question. As I say, if you have a supplementary, Karen, we will take that back and answer it in writing if we may. Do you have a supplementary?
I'm afraid my internet's a bit unstable, so I didn't actually miss the first bit of that. Presumably I can get this, the answer to this in writing anyway. Oh,
we will certainly, yes. I'm very happy to send you the answer in writing. And then if you have a supplementary question in relation to that answer, put it back to us and we'll deal with that, or well, officers will deal with that. And no doubt Councillor Bowick will deal with that as we need to. So thank you. Thank you for that one. Now I've got to work out how I go. Oh yeah, I think it's that one. Right. I'm using Gordon's laptop, so it's a little bit difficult. So your second question, which is now on the screen, the answer to this is that the housing team have recently migrated to a new data system, and the figures are being provided to you for the period between the 14th of April 2020 and a couple of days ago, the 7th of December 2021. Over that timescale, the shortest time that anyone was in temporary accommodation was 10 days. The longest time that anyone was in temporary accommodation was 602 days. The average time, 202 days, and no specific trends have been identified in that period. So those are the raw numbers. As I say, if you have a supplementary, we'll take that away and respond to it in writing. Do you have a supplementary on
that? No, but you can see what I'm getting at, the fact that are things getting better?
Well, I think the question is that whether there is if a trend can't be identified to some extent, that's an unknown. But I think I'm happy to let officers explore that with you a little bit. So I mean, maybe in the same way that we will respond to you with the written answer to this one, we'll also put the written answer to the previous one. We'll also put the written answer to this one in the same email, and then you can come back and question that if you wish to, if that's the best way of moving forward.
Yeah, thank you very much.
Thank you for your questions.
Thank you.
So now we do actually move on to Councillor Stewart for question 3.
I was quite prepared to try and go through all those figures, but you did it far better than I would have been able to. Thank you, Paula, for your question. The CCG's review of continuing healthcare will be considered later in this meeting, and I don't want to preempt any decision that the board might make. The Health and Wellbeing Board has the option to bring matters to the attention of the relevant scrutiny committee, as you know, as something they may wish to consider as part of a future review. Also, members of the public can suggest items for scrutiny using the online form that is available on our website. However, both the Overview and Scrutiny Management Commission and the Health Scrutiny Committee, that's a mouthful, all of those, are responsible for setting their own work programmes, and any such request would need to be considered by the relevant chairman and prioritised against other competing items for inclusion in those work programmes. As continuing healthcare is arranged and funded by the NHS, this would suggest that the Health Scrutiny Committee would be the most relevant scrutiny committee to consider this matter. Do you have a supplementary?
Can you hear me?
I can.
Yes, thanks, Jo. Obviously the session is coming, but the slides don't seem to relate to the action point. So the emphasis of this, when I first started asking questions about it, was the level of awards. And the last statistics, we were down to 4 per 50,000, and the reasoning behind why Berkshire West CCG is one of the lowest in the country. So I wouldn't want that to be lost. I appreciate what you say about the scrutiny boards, and I can put in a public request. But it wouldn't be unusual, because on the 10th of December 2013, 8 years ago, almost to the day, this very subject went to the Overview and Scrutiny Commission. So I would hope that the Health Scrutiny Commission would be able to pick up.
Paul, I'm very happy to have a chat with the chairman of the Health Scrutiny Committee on the back of this question and this meeting, and the outcome of the conversation later on about this the paper that we'll be looking at. So I'm very happy to do that on your behalf anyway.
Thank you very much, Jo.
No problem.
Thank you both. And both Karen and Paula are very welcome to stay as attendees to observe the rest of the meeting if they wish to, but I'll ask Zoom host to make sure that they are put into the attendees panel room. I'm just checking. Nikki, I can see Nikki Cartwright is in the meeting. So Nikki, you've no doubt heard what was just said, and maybe you can pick up any aspect of that you think necessary when we come to your item. And in that respect, I am going to members, as I have done before, and we'll come to it in a moment when we get through the formal stuff, move some of the items around to enable those who've attended this board to make presentations, and our members of the board to leave if they need to. So I'm going to get rid of petitions next. Are there any petitions, Gordon?
We haven't received any, Chairman.
And does any member have any petition they wish to present? No. And membership of the board. This is a standing item, and there's one change to note, and we welcome to her first meeting of the Health and Wellbeing Board, Tracy Daskovitz, who is the new Director of Public Health for Berkshire West. This is simply change of personnel, and if you recall, we made a decision to effectively give positions on the board to posts, and the post of Director of Public Health has a position on the board, but I would ask all members to note the change. I would also ask all members, and I'll ask Gordon perhaps to circulate a current membership list to all of the board members, to just check that you've got a substitute, because sometimes you won't be able to turn up, and some of the board places do not have an identified substitute to send in their stead. And we do need to be formal about that, because this is a formal council committee. So can we just tidy up anyone who hasn't got a substitute? Thank you. Okay, so we are now bringing item 11 up the agenda. This is the transformation programme for children and young people mental health, and Manu is going to speak to it. So I'll start by asking Manu to present the item, and then we'll come to any questions for. Gordon says she might be a little bit late. So what I will do is I will just ask Nikki whether she would like her item to be brought up the tree, as it were, in anticipation, so we can move through that item and release her.
Thank you, Chair. Is that the CHC item?
Yes, it is.
Yes. I'm just in conversation with Manu, so I will tell her not to panic because something urgent has come up. And then, of course, I'll be delighted to present the CHC update.
And while you're having that conversation, I'll just see what Councillor Vickers has a point to make.
Well, I was just going to suggest the item on Health Watch about CAMS relates to this item too. And in the agenda, I think the transformation item comes before the Health Watch item. And in a sense, the transformation item almost follows on from the Health Watch item. I wondered if it might be appropriate to have that one, if the other one is going to be happening soon. I don't know.
I think I would say in response to that obviously Andrew's on the call. The Health Watch report has been circulated. I think we've all been able to read it well in advance of this meeting, and no doubt Manu has definitely read it. So I would hope that when we come to that item, that will be picked up. But I'd like to obviously ensure that those who are simply attending to present items and not here, as Andrew is here for the whole meeting, get to be released. So let's stick with that plan. So Nikki, can I come to you to deal with the CHC item, taking on board what you've just heard in the public questions?
Yes, certainly. So I think what would be helpful would be if we're almost at the end of Q3. So if I share a performance dashboard, would that be helpful, Chair? When we get to the end of December.
Visuals are always good.
Yeah, I'll do that, and also make sure there's some context around it and some description as to if you see this is what this tells you. If you see this is what this tells you. Because the thing about CHC is it is a process, starting with a referral and a checklist, and then different things can happen at different points through that process. So I will do that very happily.
Sorry to interrupt you, Nikki, but what I would say is that let's remember that there will be members of the public, hopefully, watching this. So it's not all the professionals. So maybe we can just bottom out some of the verb, the words that the titles use.
You mean our lovely
explanation of an explanation of what CHC is in the first place.
Yes. Well, continuing healthcare. So continuing healthcare is funding that is made available to people when they have very complex health needs. And I think what's important to recognise is that it's actually the one time in your NHS journey as a patient when you can be told yes or no, you can or you can't have this treatment or this funding. And I think that's sometimes quite difficult for us all to understand, because we all live with that belief that the NHS is free at the point of delivery. But with CHC, a decision is made as to whether somebody is eligible or not eligible. And that can be difficult to grapple with, I think. So is everybody able to see a copy of the slides that I sent in? People have that in there? I know it's in the agenda pack, but you're not expecting me to share it on screen, are you?
We might share it. Gordon, what do you think? You're going to share?
It's just that I have to work on an iPad, so because it's Zoom, so it's a bit trickier.
Sure. I'm just looking to Gordon as to whether we're going to be able to share that presentation. Looking good so far. It's up on his screen.
Fabulous.
So bear with, but just remember you're going to have to tell him when to change a page.
Yeah. Thank you, Gordon. That's brilliant. So good morning, everybody. I'm Nikki Cartwright. I'm the Director of Joint Commissioning for Berkshire West Clinical Commissioning Group, and the continuing healthcare team sit within my management responsibilities. So the reason I'm here is that we met, I think I attended back in April, and agreed and to come back about this time of year to update you on some of the changes that we were making to our processes in the continuing healthcare team. So that's what this presentation is about. It's very short, very succinct. So this is the first, next slide. So thank you very much. So we had a look at our internal processes, and they were a bit convoluted and time consuming, and we stripped those right back and decide and have come up with a much simpler process map for our teams to follow. So we have a process. This is how you do it. This is how we deal with applications, and we get them to the point where we know whether it's a yes or a no for individuals. We've divided our team into one who is dedicated to managing all new applications. We have a 28-day response time, and we have really significantly improved, and you can see that at the end of the presentation, our response time from something like 20% to 68% falling within that key performance indicator, and we'll continue to work on improving that. We not only do we have a team now who deal with all our new applications, we now have a dedicated review team. So we've separated out those two processes, and we now have a team who focus on reviews and case management, because we had a number of reviews that were overdue, and that's not helpful. We've recruited some interim staff, and those staff have all got significant experience of change management and have been able to present quality applications within the 28 days. Again, it's, the better your application is and the information that you have available, the easier it is to make a decision. You're not then having to look for evidence. Next slide, please, Gordon. Thank you. We think, obviously, local authority colleagues would have to probably comment on this, but we think that our management of our local authority disputes meetings have been held with reduced delays, which is great. We've seen an improving relationship with stakeholders, and we've actually had compliments from all three of our local authorities, because we don't just work with West Berkshire, we work with Reading and also Wokingham. And we were very, very conscious that at times that relationship had become fractious, and we wanted to improve on that. We still have work to do. We still have a journey to complete, but we are definitely seeing the benefits of that. We've started a provider engagement forum with the support of CCG Leeds. So talking to our providers, as you know, the care market is quite fragile. But if we can talk to our providers and hear what they're up against, what difficulties they might be facing, then that helps us when we're commissioning those providers. And lastly, we've had a review and a refocus of free nursing care, or FNC as it's sometimes referred to, and we're seeing an improvement in that area. And then here's just a trajectory. So that just shows our it's some October data, and if it would be helpful, I can give you some more up-to-date data when it becomes available. But that just shows that our 28-day reviews are being achieved. Could I have the next slide? And then finally, 28-day targets. So in Q1, which is that was during 21-22, so that was the April to June. We had to agree a trajectory with National Health Service England. So that trajectory was 20 to 29.9%, and we achieved an actual target, or an actual trajectory of 25% in Q2, which was July to September. Our trajectory was 30 to 30.9%, and we've achieved a target, or not a target, we've actually achieved 61%. I think it'd be helpful if, as I said, when we get to the end of Q3, I share that update, but also I can give you some more performance information. So that is it. That's my sort of update to date. Obviously, very happy to take any questions.
Thank you for that. And you spoke through the fire alarm. We were sitting here with we were sitting here with a very, luckily the microphones are off because it was pretty loud in here.
Would you like me to do it all over again?
Yeah, no, I think we followed it. I was thinking that Paul Coe was here, going to substitute for Andy Sharp, the other Andy Sharp, and I was expecting that he would be the one to approach for the council's view of CHC. Let me just ask you about this, and I can see Councillor Stewart's got her hand up. As the previous portfolio holder for adult social care, and Councillor Stewart will come in as the current portfolio holder for adult social care, we both had concerns about where, and these concerns have been expressed on a number of occasions, and indeed Paula Saunderson has expressed them in questions previously, about where Berkshire West, and in particular the entities within Berkshire West sit within the national picture on CHC. So if you could just maybe expand on that, that status, the concern was always that we weren't getting our fair share of the wedge, if you like, in order to recompense what adult social care had to spend on stuff that adult social care reckoned should be National Health Service spend. So perhaps you could just go, and then we'll see if Councillor Stewart's got to say, well, actually, I'm going to ask Councillor Stewart to come in because she may well have a very similar or expanded question, and then you can pick the whole thing up together.
Sure.
I'm slightly different, but I was going to say, so on your slide where it says about the start of a provider engagement forum, I'm hoping that we also have the opportunity, or how do we, as a local authority, engage with that forum? Are we invited to that table, or I just think it would be really useful if the local authority, the adult social care services, aren't already invited. It would be great if we could do that, and I can find you the right people to be involved in that.
That would be really helpful. Thank you.
Nikki, before you answer my question, Andrew,
Yeah.
I note your hands up, so bear with me. I'm just going to look to Maria. Maria, do you have anything you would want to say, given that you're in the room, on this particular subject?
No, I would probably just echo what you've already said, Graham. I would like to see where we sit compared to the national table and compared to Wokingham and Reading, because I think historically we've been quite poor in terms of the numbers that are approved for CHC funding. So, yeah.
So I'll let Nikki answer that one, and then I'll come to Andrew.
Thank you. So at the moment, national average is 7%, and we're sitting at 10%, Berkshire West CCG. So when I give you that performance information, I'll set it in the context of national and then Berkshire West, and then I should also be able to break that down into the 3 local authorities. So you can see not only the percentage but the actual numbers. I presume that would be helpful.
I'm sure that would be helpful.
Yeah.
Andrew, let me now turn to Andrew.
Hi, Nikki. We've discussed this prior, and I think from a patient perspective, I'm delighted to see that the review and the sort of simpler process, because for those people who have no direct involvement of CHC applications, the burden on the carers is tremendous at the time of their greatest challenge. They are caring for severely ill people, and they're being asked to go through an incredibly complex process. And one of the things I was really hoping we'd get out of some sort of review or look through this is actually potentially support for people applying, because they have their hands full. They are on the spot 24-hour carers, even if they do have help from adult social care. The conditions that this covers really are absolutely life-changing. And I think sometimes that gets lost in the sheer process of the process, and people start forgetting they are residents of West Berkshire who are struggling with the most difficult circumstance they will ever struggle with, and yet they are still expected to act like management consultants in terms of record keeping and proving their case and what have you. And you know, for many years, as Paul has pointed out, it very much feels that, you know, you're likely to get a no unless you can prove you deserve it. You know, cases we've had brought to us have been, you know, really difficult, really stressful for the people, you know, and bizarrely, you know, we've had cases where it's taken so long that, you know, certainly one locally to me, the applicant was informed they weren't going to get any help with CHC and died 4 days later. So in terms of severity of case and things, I think this is a brilliant opportunity to absolutely just look at this afresh and say, is it delivering for the residents of West Berkshire? We have a higher proportion of older people who are likely to need it. So if anything, I would expect West Berkshire to be at the top end rather than the bottom end, which traditionally it's been. So I just want to, and also if we are putting provider boards together, where's the patient representative? Where's the patient voice? You know, is there any advocacy support that could be given to people going through this process? They really, really deserve it. So if you could take those away, that'd be great. Thanks.
Do you want to come back on that, Nikki?
Yeah, I think so. I think we're just important to remember that it's not about illness; it is about needs, and you know, that national framework is fixed. So it's about your needs and the complexity of your needs and the severity of your needs, and I think that's what's really baffling for people. You know, as Andrew has alluded to. So it isn't about the, you know, your illness that you have, and maybe we just need to draw that out, and perhaps you know, I could do that in that performance report. I think that might be helpful. It's really interesting, Andrew, about the support for people applying. I'm not sure that would come from the CHC service. I wonder if that's about the engagement of the teams who are putting in the applications and how they're working with carers and patients. And so perhaps, Andrew, you and I can pick that up in our regular catch up and just explore that. Should we do that? And then we could report back.
Thanks for that. And Abid.
Yeah, thanks, Chair. So I think just wanted to echo what Andrew said. You know, it's a really difficult time for patients, and I think all these changes will be excellent, Nikki, to help smooth that pathway, and working with the patients and families and carers to get this done. I think there's still a fast track process as well, I think, for patients at end of life. So just need to make sure the committee is aware. So there is a fast track process, and that works really well. To get that support.
Yeah, well, that's interesting, because we've actually got a meeting at the end of today with all 3 of the local authorities to see how we can improve that process, because I think people are feeling at the moment it might be a bit clunky. It'd be great. It's good to hear from a primary healthcare professional, GP, that's working well. But we're just doing a check-in on that at the end of today, funnily enough.
Yeah. I was just going to make the point. I mean, I think Paula mentioned that this matter did come to the Health and Spiritual Committee, and I think I attended that meeting. It was quite a long time ago. But I think in the interim, when we've looked at where we rank as a CCG in the tables, and I think there's been a number of reviews to look to see that at the process, was the process fair and was it right? And I think the reviews concluded, from my memory, that, you know, there was effective quality decision making, and the process was for being followed correctly. So I don't know if anyone else has got any historic memory on that, but I think when we did look at that, the evidence didn't show that, as you said, Chair, that, you know, we weren't getting a fair kind of portion of our funding. So I think that's been evidence, but it's always good to look at that again and see where we are, and improve the process. Absolutely, totally agree. This is critical for patients, and those patients who need that funding should be getting it.
Yeah, and that's exactly it, Abid. That's what I'm constantly saying. If people are entitled to CHC, they should receive it. But it is a national framework, and that is what we have to apply. And that's the the tricky bit. The other piece of work that we're doing, again with the 3 local authorities, is looking at and addressing having a joint funding policy. So that will be for people who don't meet continuing healthcare, but may have healthcare needs that can't be met by universal NHS services. How could we commission services to support those people? Again, you know, who have got complex needs but aren't eligible for continuing healthcare. And that's, again, a piece of work. We'll be piloting that in January to March. And that's come through Unified Exec. So again, that's another change and I hope another improvement that we'll be able to make. Small steps.
Thank you both. And Maria.
Yeah, just to build on the conversations, adult social care do employ a CHC specialist, and her role is to work with social workers and social care practitioners in supporting families submit checklists, and she also sits on the panel with health colleagues to review those checklists and attends MDTs. But there is only one specialist that we employ within the local authority, so that might be something we need to look at in the future. But also to say that if social workers are supporting families to submit checklists, they have to do a training course which the CCG provide. I know we have one coming up, Nikki, but it might be something that we need to think about running more regularly so we can ensure that our practitioners are trained, and then that way we can support the process a lot quicker.
That sounds brilliant. I'll take that back to the team manager, and because I haven't met with Paul recently on this matter, but we can pick that up in that environment.
Right, members, I think that's all the questions for Nikki. So Nikki, thank you ever so much for coming and presenting and facing that barrage, and look forward to hearing further as you take further steps and as things progress. So, and you are released. Thank you.
I'm actually staying to present the ICS, developing our integrated care system.
Right. Okay. Well, I'm not going to bring that up the tree, I'm afraid, because I'm going to try and get some other stuff out of the way. What I am going to suggest, though, I'm going to take Councillor Vickers' suggestion, because what I have is what has been pointed out to me is that Michelle and Leslie are both here to present the CAMS report on behalf of Healthwatch, and since they are also guests, as it were, and since it does naturally lead into the item on children's mental health, I'll take if I may, take the Healthwatch report first, and then Manu, if you could maybe pick up some of that commentary, should you wish to, when you present on your piece on the transformation programme, that maybe wrap the whole thing up quite neatly. So Michelle and Leslie, if you care to, I don't know how you're going to play this one between you, I'll leave you to present as you think fit.
Good morning, Chair and members of the Health and Wellbeing Board. I'm going to go first and then I will pass over to Leslie. So I'm Michelle Pace and I work for Healthwatch West Berkshire. I'm just going to give you a tiny bit of a background to the CAMS report that we did, and then I'll pass it over to Leslie to finish off. So back in January of 2019, a personal experience of mine, my son was referred over to CAMS and I was told it was going to be a 2-year waiting list for him to be seen. And I kind of thought to myself, well, if it's 2 years for me, then I can't be the only exception. So on the back of that, I thought, well, actually, if it's affecting me, it's going to be affecting a lot of other families. So we held in July of 2019 a focus group for people to come in, just so we could get some feedback about how people were feeling about the CAMS service. Obviously, COVID then hit and we weren't able to have any more focus groups. So we decided that CAMS was really important, and maybe by holding an online survey, we could get some more feedback. So that's what we did at the beginning of the year in February 2021. We published an online survey for users of CAMS, parents, carers of people that were using CAMS. And we were lucky enough to, within a month of putting the survey out, we got 128 responses, which was a great amount for the short time that we had. So before I just pass over to Leslie, I've just got a couple of figures just for you to have a think about. Obviously, you've all read the report. So 93% of the respondents to our report have children of school age. And of those, 9% said they had to wait 3 to 5 years for their referral to CAMHS. So I'm going to pass over to Leslie, who will talk about the results and the recommendations. Thank you.
Thank you, Michelle. Good morning, everyone. So the questions we included in our survey, we kept very simple. And the respondents were all parents and guardians of the children and young people either accessing or waiting to access CAMHS. So there were no direct users as such. So aside from the age, we asked who had to wait for a diagnosis, how long they had to wait, if that's what they had been referred for, or how long they'd had to wait to be seen for any reason by CAMHS. We also asked them to think whether the CAMHS service had made a real difference to their child having been seen, and if an earlier access to CAMHS would have made more of a difference. We also just asked a couple of questions about information. Was the information they received useful, especially on discharge, and if they'd like more information about where to get help and what suggestions they had for improvement. So there was quite a lot of free text, which I analysed thematically and drew out the most important.
Leslie, I think you've muted
yourself.
Sorry about that. Of the 128 respondents, we felt was a good response. We did have information from BHFT Common Point of Entry, had 1,600 referrals for the whole of Berkshire West in 2021. So we've sort of figured if we said around a third of those were from West Berkshire particularly, then our survey number of 128 out of around just over 500 could be seen as fairly representative. So in the report, we did include some data from the Children's Commissioner report on the state of children's mental health services in 2021, just to really put it in context nationally. And the report showed a very big increase in referrals for CAMHS nationally from 1718 through to 1920. But those accessing treatment increasing at a slower rate than referrals. So this is a national problem, not just a problem for Berkshire West. It was also suggested that the pandemic and lockdowns may in some measure certainly have accounted for the increase, but it was felt that there was a risk that this would continue, that the increase would continue, that it wouldn't just disappear really. Obviously, Berkshire West does have high waiting times, and we mentioned that. Indeed, the main issue really to come out of the survey was around the waiting times. This was what was distressing parents and guardians the most. And about half of all respondents reported waiting between 1 to 3 years, either for a diagnosis or for access to CAMHS for any reason. And obviously the long waits have negative consequences for the children and young people themselves, where their conditions were felt to be worsening. It affected their education, and also other family members were being affected too. And 3/4 of respondents did feel that actually an earlier access would have made a difference to their child. Overall, the service itself was not felt to be completely satisfactory, that it was not making the difference that the parents and guardians had hoped for their children's condition with the mental health problem. They felt they weren't getting enough information, the right information at the right time, especially on discharge. And they wanted more information about alternative services that they could use, more support, more communication about where to get help. So in terms of the recommendations we linked to the priorities in the local transformation plan for children and young people's mental health and well-being, the 29 refreshed version. There has since been another version which was published in September. So it definitely fits in, it dovetails really with the recommendations in that plan as well. They're simple, the recommendations, and they're clearly linked to the responses that we received. Obviously, a recommendation for decreasing waiting times is what you would expect, but also that the children and young people and parents and guardians are better supported and communicated with throughout the whole CAMHS journey, from referral through diagnosis and treatment and through to discharge.
Right, this is to some extent a test. Let's see whether the YouTube is picking this up, and if we go back to full screen, we're back in the room.
Was that an echo then, or did you know that? I get a test. Okay, that's fine. Should be okay.
Right, I'm told that we are back as we were. So let us continue. Apologies for that somewhat sharp interruption, but I got told I had 30 seconds. Leslie, over to you.
Well, I've no idea what people have heard and what people haven't heard, so I'll just carry on from where I left off, really, which is to talk about the recommendations. Obviously, I've mentioned the waiting times and the need for better support, both for the children and young people using the service and the parents and guardians. And also that support is accompanied by better communication across the board with all services. We recommend that the local transformation plan aims and objectives would be fully implemented, which kind of goes without saying, but we felt it important to make that recommendation. And as I mentioned, they have been now updated and are on the CCG website. There is also a recommendation to improve staffing within CAMHS to deal with the increase in referrals. The final two recommendations are included to really try and help us to consider how we're going to stem the referrals being currently received for specialist mental health treatment. And as we're all aware, in terms of public health, the importance of prevention and early intervention. That if we don't have that prevention and early intervention, then we'll continue to see an increase in the need for the higher end services. But if we get those early intervention and prevention services right and get the pathway right, then we're far more likely to take the pressure off of CAMHS services. We really therefore are proposing that there's an improvement for the whole system, whereby all services, the services that are available in schools and in the voluntary and community sector are included, and that they dovetail together with better communication and liaison with CAMHS services. So there becomes a single comprehensive system to address the problems, mental health and well-being that, for children and young people, a clear pathway. Indeed, to quote the LTP, everyone who works with children and young people can identify issues early, enable families to find solutions for themselves, provide advice and access help. Agencies must work together more closely so that vulnerable children can access the help that they need easily. The plan has many excellent medium and long-term goals, but we would like to call for everyone on the board to consider what can be done in the short term. What can we do? What can we do to improve the situation now for those who are waiting, for those who are suffering really, and how can help be accelerated? And also, really, how do we also look at the wider determinants of health that affect children and young people's mental health and well-being? So we have many excellent services that are already working locally. We have family hubs that are providing parenting skills and support. We have the Emotional Health Academy that's well established in the schools. We have services like Time to Talk, counselling services, online, also online services. All these things are out there, but they need to somehow come together and provide more so that we can really improve and decrease the number of referrals that are coming through to CAMHS. Healthwatch West Berkshire is in a good position because we have this hub of people who are really keen to make changes, people like Michelle and many others who are really wanting to see improvements. And we can ask them, we can go back to them, ask them more specific questions, find out more about what they think will work, and they can be part, and we can empower them really to be part of the solution, and to work with providers to improve the services that are available for mental health and well-being of children and young people in West Berkshire.
Thank you. I'm going to take questions now. I mean, I've obviously looked at the recommendations, and obviously only one or two of them, wholly or in part, actually tie to the council's activities. They are very much for external bodies, and we've got recommendations about effectively pressing upon those external bodies to take on board those recommendations, and we'll deal with that in a moment. But let me now take some questions. So I have a number of hands up. Start with Councillor Stewart.
Thank you, Chairman. You won't be surprised to know that as mental health champion, this report really interested me. I think it's a really sound piece of work, and thank you to those involved, Leslie, Michelle, Healthwatch, because having it all in one place is really interesting to see. I have a family member who has personal experience of waiting 3 years for a CAMHS referral. And I can absolutely agree with the fact that the pressure that it puts on the whole family is really quite alarming. The young person involved absolutely has not had the level of education that they should have done. And that's 3 years that has been lacking. I'm pleased to say that he now seems to be in a much better situation and the family are thriving. But it shouldn't be a case where this actually has to happen. I realise that, that there's a huge amount to unpack here, but I just wanted to refer to a couple of points. One was that quite alarming that those people who eventually did get to see somebody felt that it wasn't effective. And I guess some of that could be down to the fact that waiting 3 years has led to a situation where perhaps the situation has become unfortunately more severe, or indeed they've been able to find, that they've actually been able to self diagnose in a way and find information through other sources. I would suggest that any work that we do, it would be good to understand I think it was something like 10% maybe who said that they thought it was good. So there's something that has worked for some individuals. So, albeit a tiny sort of proportion. And thank you for the information on the sort of population group that we're talking about, because I wasn't entirely sure on whether 128 was a representative. But actually, if we go with your figures there, it's about sort of 25% of those in West Berkshire that may well have been referred. So that's interesting to know. I've got one observation. So as Councillor Bridgman has just said, in terms of some of this being something that the West Berks Council have some control over. And I think certainly the recommendation about preventative and early intervention services is one of the strands that we have within our own health and wellbeing strategy. So that's good that we're connected in there. There was also one around data, so ensure that all public health data relating to ongoing mental health and wellbeing of children and young people is regularly reported into the Berkshire Health and Wellbeing Board and local service commissions. Now, I've put a comment there, said, are we not already getting this? Is it a case of it's pulled together somewhere, but we need to specifically ask for it? Because I absolutely, as I say, as mental health champion, I absolutely would like to see this. And I'm not sure who that question should be directed to, but I absolutely say that we should definitely be making sure that we have access to all of that data. And I'd like this board to have it. If not, I would like to have it so that I can work with groups that I'm involved in. And my last point would be about the mental health action group. So I hate to overload our group, but you know, this is something that for me feels like it needs to be pulled into a group of people that are specifically looking at how we can improve mental health, not just in adults, but in our young people, because those young people are going to transition into adults. So we absolutely need to make sure that we're giving them the right sort of grounding and giving them the support they need when they need it at a young age. I'll stop there because I realise you've got lots of hands up. So, but thank you very much for your...
And I will come to those hands in a moment. I think I would simply reflect that, yes, absolutely, data is going to be key to some of these things because we need to know with anything, any of our strands of health, mental or otherwise, what we're doing to improve and whether it's working. And you've got to have data to test those questions. It clearly, and we'll look at the strategy shortly, it is a chunk of the strategy, children's and young people's mental health, and there are all sorts of strands of activity in relation to that, and there will be KPIs and data around that. And you've referenced the mental health action group, and there will be data and actions in there as well. So I'm sure that we will discuss how data and information comes to the board in due course when we look at the strategy in particular. But I would reflect that I think that there are the avenues for that information to find its way into board members, and so board members can reflect on it and ask questions that they need to. Councillor Vickers.
Thank you, Chair. I'd also obviously like to thank Healthwatch for this report, which was, I thought, very clear and easy to read for any members of the public that are reading these documents. And it's important to remember that this is a public meeting and we're talking to the public and not just the council. And also for the acronym booster at the end, which I think is something that's often sadly lacking in some of our reports. So I think you've shown up some good practice there. So thank you very much. And obviously for the valuable, real value of having human stories here, I think this adds so much more than just looking at a report that gives us statistics. So I think the human stories, and thank you for Michelle, for if she was the one that initiated this because of her experience, and it just shows the value of the personal experience. So thank you so much for that. What I wanted to sort of draw out, and obviously it's already been mentioned, but just to accentuate the importance of prevention and early detection. And this is something where the council has a real role to play. Our own health visitors are actually important in picking up when there are problems in childhood. And I know there used to be, hopefully this is not the case now, that a child under 5 with any issues, that the immediate reaction from anyone he was referred to, he or she, was, oh, it's to do with parenting. Now, I'm sure that's not the case. Michelle is smiling. I'm sure that's not the case, because I think we all know, anybody who works with children, that very early on, you can see in the way a child is behaving that there's something not quite right, whatever it is, you know, and also obviously parenting, the reaction to that difficulty can often accentuate it. So it's really important that there's the support there in the early detection. And this is where health visitors come in. This is where our family hubs come in. And sadly, we've seen a reduction in the service that family hubs can provide. And this is a question I recently put to full council, because I know that there's no longer one in Greenham, there's no longer one in Lambourne, and these are areas where we think there's probably more need than, you know, there is some areas of deprivation and there possibly a little bit more need for support in some of these areas. So I really do think the council should look at the support it's giving to families when they are struggling, and to make sure that we've got that support in the areas where it's needed. We've got the staff to do outreach work. We've got our health visitors, our school nurses, all this stuff that we are responsible for, trained in early detection, so that we can actually nip things in the bud if they're not serious issues that are going to develop into serious psychiatric problems for children, which is where CAMS comes in. But those early ones are nipped in the bud, the support is given, and they don't escalate. And so that, I'm sure, would help the service. And we all know that, you know, anybody that works in mental health will know that when they see adults with mental health problems, quite often the problem has been in childhood. If it was picked up early in childhood, then the outcome would have been so much better. And in many cases, adults would have not had wasted lives. So this is such an important issue. So thank you for bringing it to our attention again.
If he was in the meeting, I'd go to Councillor Berwick now. But since he isn't, I'm going to go to Councillor Doherty.
Thank you, Chairman. I just wanted to I'll come to the point in a minute. I just wanted to come back to the point that Councillor Vickers has just raised, because the Family Hub service actually operates the same way it always has operated. It changed the model to reduce the buildings, but to do outreach work, to actually take the service to people in Greenham and Lambourne rather than ask them to come into a centre. So I'd actually say that's a changed model and that the service still exists. I do have a couple of points on the report. Do you want me to?
Well, I'm going to get to. I'm sure I'm going to get to everyone. So you may as well speak now while you have the mic.
Okay. I was going to thank you for the report. It's a really interesting one. There is data that has always come through to this Health and Wellbeing Board, which the last time I saw it was when Sally used to bring it along on a regular basis. I thought we had a waiting time of about 18 months to 2 years on CAMS. So I'd be really interested to see the actual data, and it would be good to get a trend of that, because that actually, what Michelle's just said, sounds like things have got a lot worse. So I'd be really appreciative if we could actually see the data from CAMS with regards to their waiting list, because I was quite surprised when you said 3 to 5 years, because I always had in my mind 18 months to 2 years. However, I'm not saying that's good enough either. This has been an ongoing issue, and my understanding of it was that services should be available to people even while they're waiting for that diagnosis. So if that situation has changed, I think that's something that we need to look at. The one thing I was going to talk about was, and you said it yourself, Leslie, and I know you know all this work really well, Leslie, having previously been with us within our public health teams, that we've got a really good offering here in West Berkshire. We've got lots of fantastic services doing that early intervention and prevention work, and you said they just need to do more of it. One of the things that strikes me, and I remember when I launched the Emotional Health Academy here in West Berkshire, was talking to young people, and it wasn't necessarily the things that we can directly have a service for. People were talking to me about what was it that they had concerns about their mental health. And this is actually one of the great things about the Emotional Health Academy is it's about resilience and coping techniques. But young people were telling me it was things like peer pressure, social media. They were the things that were impacting. So when you talk about prevention and early intervention, it's what can we do with some of those societal things that impact on a young person's mental health and well-being. And I don't think I haven't got the answer, and certainly when I was talking to young people about it at the time, it was what more can we do as a society to support young people full stop, rather than specific services that support when there's started to be an identified need. So there's a huge array of stuff, but it's a really good report, and it's really good to be having this debate because it is an issue of massive concern. I'm actually quite proud of the amount of services here in West Berkshire, but I think we can always do better. But I'd certainly like to look at the data with regards to CAMS and see where that's at the moment.
Thank you. And Gary.
Thank you, Chairman. Yeah, great report, Andrew. Lovely templates you use as well. I think I've only got a very small thing to say, really, because we all say how wonderful our services are. You know, voluntary sector, time to talk, come up from time to time. I think really what we're talking about is capacity before crisis. It's that simple. I think it's capacity, and I would just suggest with Councillor Stewart and the Mental Health Action Group, if we just bring these organisations in a roundtable situation and say how can we build capacity, how quickly can we do that? We're often told round about now there's some winter pressures money, and a huge amount of efforts go into spending very little bits of money for 3 months. And it's just kind of wasting. So if we could just put some of that energy into actually sitting around and actually building some of the capacity in these services. Totally agree with Lynn in terms of some of the issues that young people are facing. And I do think we need to sit down and tackle that. There may not be national policies how to deal with, the minimisation of using all these various social media, but why can't West Berkshire have a go at this and actually try and change the culture a bit? So, but I think as for me, it's capacity before crisis, because when people do reach these services, whatever services they are, there's always massive relief that they've got to the service. They've now got an appointment. They're now speaking to someone, and all of a sudden the family can say, "Whew, great, we've started." So let's get to that point.
Thank you, Gary. And Abid.
Thanks, Chair. I think a lot of the points have been made already. As a frontline commission, I see this all the time, and I think I totally empathise with parents and children who have to wait. And this has been something that's been high on our agenda, certainly as a commissioner. And Nikki's still on the call, so I'm sure she'll come in. We looked at this. We've been looking at this in detail at the CCG and working with BHFT colleagues to really get those waiting times down. And I think earlier on this year, we committed to making a significant investment to invest in more care, kind of mental health workers, utilising more of the digital online assessments, which can get patients seen earlier and quicker. But I think, as the point's been made, it's critical that while families are waiting, it's that signposting to those early services, so they've got the assurance, they feel confident that they're being listened to, and there is something they can be doing while they're waiting to access those services. So I think Gary makes a good point about capacity as well. We certainly refer quite a lot to time to talk, but I think the waiting times are creeping up. The emotional kind of health academy, again, I think they're doing an excellent job, but I suspect they're probably overwhelmed as well. So if we can beef that communication and make sure that families and children have got that confidence while they are waiting, then that would be excellent. And I think there is a commitment from our part to get that waiting time less than 12 months. I think that's what we've invested. Nikki's probably got the figures. I think it was significant sum of money, about 2 million. I might be wrong on that figure, but I think that's what it was roughly. And there's a detailed plan of action, so that should give confidence to the committee that that those waiting times hopefully will come down. But the demand is there, certainly. For neurodiversity referrals, the number of patients we're seeing coming through is massively increased. So it's trying to just keep up with it as we try to bring those waiting times down and trying to match, capacity with demand. Nikki, did you have anything to add to that while I was on that?
Yes, thank you. 1.8 million was the investment that we have made this year and in the following year. I think it's just need to be clear that waiting time, which is not acceptable, is for autism and ADHD, that there is work that takes place with families and with children and young people whilst they're waiting for that assessment. And I think maybe it'd be helpful to present some of that information to the Health and Wellbeing Board, because that will show that people are not just left on a waiting list. And I think just also to be clear that a diagnosis of autism then doesn't mean that you get services. It is a diagnosis. It's not something that can be cured. So it's then about how you adapt and how you live with that diagnosis. I know that where we are at the moment, that investment would cover extra capacity of 25 staff, and we've been able, BHFT or Berkshire Healthcare Foundation Trust has been able to recruit 14. I think we just need to put that in the context that every NHS body at the moment is recruiting staff, and we are sort of fishing in a small pool. So again, we're having to think really creatively about how we can run those services. Thank you.
Thank you for that. And I continue to reflect, come to Matt in a moment, that this will be a key element of the new strategy across the whole of Berkshire West, if we agree it later in this meeting, is in relation to children and young people's mental health. So, it's something that we will be coming back into the board on a regular basis. Finally, Matt, and then I will go to the recommendations, and I'm going to take a formal vote on that.
Thanks, Chair. Yeah, I think it's largely been covered. So thank you to Leslie and colleagues. Really good report. I think it's a really key issue that we need to keep on our agenda. And as Councillor Bridgman said, we're due to discuss the action plan and the strategy in a minute. Just a couple of things from me. I think it really sticks out that we need a whole systems approach to this work. And what I mean by that, I think we have lots of rich assets and services. We've already talked about them. There's lots of investment going in, but how do we get those services to integrate and work more effectively together? And like Councillor Vickers said, look at prevention, early intervention, that whole pathway, which I know the CCG and colleagues are doing. We talked a little bit about signposting. So there is some plans to develop a Be Well website, which is well underway actually, both across Berkshire West and East. So we're hoping that will kind of a single point of access, if you like, for children and young people to go to identify those areas of support. The other point I just wanted to make, just with regards to Councillor Stewart, which we probably just need to confirm, is I think at the moment this work is looking to be placed within the children's delivery group rather than the adult mental health action group. But I think that's a discussion we can have taking forward, and then we just need to think how that then is sat alongside the Future in Mind work at Berkshire West. So again, there's ongoing discussions around the governance and delivery of these actions across all our partners. So that's the only other points I want to make. Thanks, Chair.
Thank you, Matt. And Michelle, you want to come back?
Yes, thank you very much for everybody's comments. It was just a quick from a couple of things that was said. So having spoken to a lot of people, because I've got a lot of friends and they've told me about other friends, once you do get your autism diagnosis, which I was lucky enough to get for my son just over 2 years after referral, if you then think your child has ADHD, you then have to go back on the waiting list for another 2 years. So you can't be seen for autism and ADHD at the same time. So a lot of people get their autistic diagnosis. They then are told, we think your child might be ADHD. So then they then have to go back on the waiting list for another 2 years to get that ADHD referral as well. So that was just something to add to it.
Thank you for that. And I think we all hear that and take note, and no doubt we'll feed that into further conversation. Matt, were you going to come back on? Or is that a legacy hand from Matt? Okay, members, we have a recommendation, which is, well, firstly, we all note the report. I mean, we don't need to vote on noting the report. We note the report, absolutely. But we have recommendation to endorse the recommendations in the report and ask, and obviously this is the point I made earlier, ask key partners to act on those recommendations. I'm going to look for an indicative vote in favour of those two items. If you wish to vote in favour, please put, and you're a member of the board, please put your Zoom hand up. Members in the room, I think you've seen what's happened there. I think that gives you enough of a steer. So members in the room, can everyone put your Zoom hand down? Members in the room, physical hand in front of your camera, yay or nay? Well, that is unanimous. So thank you, Gordon. You'll note the decision we've taken. So we now move on, and as I said, I'm going to pick up, because it's all part of the same theme, the transformation programme for children, young people and mental health. And Manu, I hope you're still here. Her screen is dark. Oh, no, she's come off.
Yes, I'm still here.
So Manu, over to you.
Hi, thanks for having me. My name is Manuel. I work for Berkshire West CCG as a project manager within the Joint Commissioning team. And thanks for inviting me. I'm just going to present our local transformation plan for children and young people and mental health and emotional wellbeing services. So apologies, I'm going to switch screens a little bit, so you might see me looking elsewhere. So I don't know if everyone has the presentation, but I'm just going to run through the few slides that I've provided. We have presented our local transformation plan in September. This is a statutory requirement by NHS England, so you will see.
Let me interrupt you. Gordon's going to share his screen, so your slide.
Oh, cool. Brilliant. Thank you, Gordon. So yeah, just to introduce you to our local transformation plan that we've published in September. It's a statutory requirement by NHS England, and this has been endorsed by NHS England. We have received good feedback on it, and we're now implementing it. Next slide, please, Gordon. Thank you. So the document builds on the 2019 plan and is updating everyone on what the achievements have been so far and local needs and trends, the voices of everyone we have been listening to, including children, staff, parents and carers, and anyone involved in the services. And there is a commitment to undertake further work, which is required, obviously. And also it details the resources that are required to carry out this work. And you can find the plan at the link below in the slides. At the moment, I'm working on a shorter version, which is a little bit more child and young person friendly, that we can then share with everyone and use as a comms tool as well. Next slide, please. So this slide kind of highlights some of the achievements we had last year in the 2019-2020. We have established 3 mental health support teams in 3 local authorities. This means that NHS England has committed that by 2023 we should be having mental health support team covering all pupils, all schools. And in Berkshire, so everyone in the country is approaching this in waves. So in Berkshire West, we now have 3 established teams, 1 in each borough. So we've got 1 in Reading, 1 in West Berkshire, 1 in Wokingham. And for the next year, so this financial year, we are looking to establish 2 new teams, 1 in West Berkshire and 1 in Reading. Also last year, we have increased the rapid response services offer for the children and young people, which is now up to 8 p.m. And we are now working to have extend this even further. We have improved the data flow into the national data collection for mental health services. And this obviously will help understand access data and all sorts of other data which is collected to understand needs and data on accessibility of services. We also have worked on the Little Blue Book of Sunshine, which is a compendium of resources for young people that might find themselves in need of support. And this is a tool that they can use to refer themselves into services or just to read about the feelings or the condition and maybe seek further help. We have digitalized this booklet and it's now available on all of the digital platforms such as Google, Apple. It's on our website, and it's been also distributed in printed form to all pupils in across Berkshire West. Further achievements, we have have invested to increase the workforce in the Berkshire Eating Disorder Service. There is more detail of this in the plan. We've launched the ASD and ADHD advice and guidance service, which is a wraparound service that families with children who don't necessarily have a diagnosis of ADHD or ASD, but feel that they might need a diagnosis, they can access the service and they can access support and training. There are some training programs that have been running over the last few months already. At the end of the summer, we have completed a review of all the children and young people services, mental health and emotional well-being services, which has informed our next priorities, which is what this local transformation plan is about. So if you could go to the next slide, Gordon, please. Thank you very much. You can find our ambition and commitment on the plan, which is to promote the resilience and good mental health as a priority. And we want children to be able to be more resilient and to help their families and carers and the communities also on this increased resilience, and to help more children and young people not escalate into crisis, so to give them good quality care available when they get into crisis, but primarily to avoid the escalation into it. So if you could go to the next slide, Gordon, please. Okay, yeah, so this is explaining what our refreshed transformational priorities are. So I just wanted to say thank you to the Health Watch team for the report, because most of their findings match exactly what we found during the review, and we're really working hard to try and address all of this by achieving these 9 transformational points that we have devised. So the first one is to build a formal delivery partnership arrangement, which means that we're trying to create a single access and decision-making point, that we will be taking a joint communication approach, and we'll be creating a joint set of communication tools, which will probably include a website. So our idea is to have a point where everyone needing information on mental health and emotional well-being for children and young people will be able to go to at the same point of online and trying to access the information they need, but they can also interact with staff and with each other. We have awarded a charity, Oxfordshire Mind, which is working on this transformational point for us. The project started in October, and the main points of this program are appointed to create a formal delivery partnership, but also to create a forum for youth that will be running regularly, where we will be seeking to co-produce our offer. And also to create a new version of the Future in Mind forum that we used to have, which is going to be a wider network where everyone can come in and share what they're doing and network with each other. The second point is to create a single access and decision-making arrangement across the delivery partnership. So this is another big piece of work which we have outsourced to South Central and West Commission Support Unit, which is an NHS organisation, and they're working to create a plan for us to move to a single point of access. And what this is, what we're hoping to achieve with this is to reduce some of the waiting times, but also to address to make sure that people are on the right waiting list. So as it was mentioned in the Health Watch report, there are lots of services available, but the information is all out there, but we found that with our review that it might be a bit confusing for people because there is so much available. And so we're trying to address with both P1 and P2, priority 1 and priority 2. How do we go about this to try and make it easier for people to access and to shorten the waiting times? So point 3 is to tackle the waiting time. So this is a specialist CAMS and also specialist services such as eating disorders as point 4. A lot of work has been done by BHFT. So Berkshire Healthcare Foundation Trust are leading on point 3, 4 and 5 for us. There's a lot of work being done in looking at the clinical workforce, trying to organize a system response to provide non-clinical support from the point of referral. And then obviously there's been an investment, as Nikki mentioned earlier, and a lot of work being done in the background just to try and both reduce the waiting times, but also address how we can then make the experience a bit better for the people accessing the service. In terms of the eating disorders, again, there's a lot being done for in terms of recruitment and workforce, and we're also organizing training courses for both the general practice staff and pediatricians in the acute system, so that they can feel a bit more comfortable with when anyone presents with an eating disorder and to signpost them in the right direction when they need support. What else? Number 5. Oh, sorry, this is number 5. So the crisis, 24/7 crisis, is again being led by BHF, Berkshire Healthcare Foundation Trust. What we want to do is to make sure that when children and young people need escalate into crisis, they have good quality care, which is available quickly and delivered in a safe place. The Berkshire Healthcare Foundation Trust is leading a co-production design process to set up a community home treatment service for children in crisis. They have been working on a model for a few months, and this model has been seen by many stakeholders, and I think they will be finalizing this by the end of the year. And basically what we're trying to do is to have a comprehensive coverage of 24/7 crisis provision for the children and young people, which also combines with the crisis assessment, and that the children and young people that need crisis support are seen in the right place at the right time. What else? If you could go to the next slide, please, Gordon. Another one of our transformational points, so you could go back, please. 1. Yes, thank you. So the priority number 6 is to mobilize the next 2 mental health support teams. As I mentioned earlier, one will be based in Reading and one will be based in West Berkshire. And I'm supporting the local authorities who are setting up these teams with us. We are halfway through the mobilization. We are looking into the recruitment of the base of the team that is needed, and we're progressing really well. We're doing a lot of comms with the schools that will be involved, and by September, we should have completed the mobilization for the teams to start running from October. The next one is priority number 7. So the meeting the COVID-19 surge demand. This is a bit of a operational point, if you see what I mean, is we are going to be setting up meetings, operational meetings with the main partners, and we're going to meet to discuss any pressing matters that arises from COVID or winter, and we're going to try and act fast to troubleshoot the issues that might come up. The next one is to address gaps in services and access for inequalities. So And this is a really big piece of work that we're doing. So during our review, we realized that there are 3 main groups that need improved access. The first one is children and young people with learning disabilities. That there is no common service for this cohort. The ethnic minorities, we want to look into improving access and specifically numbers of people who access the service. And then the third one is to look into improving access for people from the LGBTQ communities. So for this piece of work, we have established a task and finish group, which is working to try and understand and scope what each group needs. So the needs will be completely different. In fact, we've already had an advisory group which was made up of people from the services, people from the charities, people with lived-in experience for all 3 cohorts, and they have advised us on how to proceed. And now we're at the point where we are regrouping and reformulating the recommendations for our governance meetings to then try and act and try and improve this access for these groups. The point 9 is to strengthen our adolescents to young adulthood offer. So we're looking to improve access for the people who are kind of just about to transition to adult services or have just transitioned into adult services, so 16 to 25 cohort. And what we're trying to do is twofold. So it's still being scoped in the details, but what we're trying to do is to try and have an approach where we target specific groups so that we might manage to have big impact. So we are looking to help specifically people who are transgender, and also in this age group, and people who are moving from children and people to adult services. And we're trying to have an approach with the care leavers that is non-medical, so a bit of having a coaching approach with them and trying to understand maybe what the budget, a personal budget can do for them. And for the transgender community, we are still trying to scope in the detail, but we are trying to concentrate on these 2 groups at the moment. And then if you can go to the last slide, please, Gordon.
Manu, could I hold you? Manu, I apologise for interrupting you. Can I hold you there? We're under some time pressure because Councillor Doherty needs to leave the room at 11:30, and we have a couple of formal votes to take. So could I ask everyone, you've got the final page in your pack. I think everyone can read that, Manu. I think everyone can follow what you're saying about your progress. I would ask members who have specific questions on anything that Manu's just said. I will take a very quick one from Councillor Vickers in a moment. Would put those to you direct so we can pick that up. I reflect that a lot of what you've said, and indeed a lot of what we've just discussed in relation to CAMS, is picked up in the delivery plan. And obviously from my point of view, what is going to be very important is to make sure that we don't have different people doing the same thing. We make sure that we're all singing from a very similar hymn sheet, and we get some coordination across the whole of Berkshire West, indeed across the whole of the ICS in due course. But we'll look at that in a little detail when we come to the delivery plan. Very quickly take Councillor Vickers, and I'd like to move on.
Thank you very much. Yes, thank you for that report. Very ambitious, and I'm sure we'll be hearing much more about the progress of future meetings. Sorry if I missed this, but eating disorders, you said quite a bit about eating disorders and the support, vital support needed. And apologies if I missed it, but are they still referred to a specialist centre in Henley? Or is the access to services much more local? You do refer to home services, but I know there was a specialist centre in Reading and independent. And the other small item was there's something in your report about the Little Blue Book of Sunshine, which seems it's an odd title for something. To me, it sounds a bit off-putting, and it's just if there's any more that needs to be said about that and whether that's a useful item for young people. Thank you.
Shall I go for the Little Blue Book first? Thank you for the questions. So the Little Blue Book was co-produced with young people maybe 2 or 3 years ago. I'm not entirely sure, but I believe the name was picked during the co-production. But if you look at it, you will understand why it's called Little Blue Book of Sunshine. It's got a lot of imagery and it's a graphic design. The graphic is blue for a start, but also it kind of offers hope to the readers. So if you look at the pages, it describes for example, anxiety, describes what anxiety is in a young vibe and language and imagery, and then it describes what you can do to feel better about your anxiety and how you can overcome it. And then so basically it's like a journey from being blue to feeling better. So I think that was the thread behind it. It is really nice looking booklet. And one of your second question was about the eating disorder. I don't think there is a home treatment eating disorder, so I might have just misled you when I was talking. The eating disorder service for us is run by Berkshire Healthcare Foundation Trust, and I believe there is it's in Reading. Nikki, did you want to come in? Yeah.
There is a home treatment eating disorder service, which
is
very new. Is not run by Berkshire Healthcare Foundation Trust. It's a specialist service. So I'm very happy to provide information to members if that's helpful. Perhaps just setting out the different components of the eating disorder service might be useful.
Yeah.
Thank you both. And indeed, there is reference to meeting disorder waiting times in the delivery plan, which we'll come to very shortly. So thank you for that. That was an item to note, so we don't need to take any votes. And as I say, I do want to get through the items on which we need to vote. So I'm now going to take item 8, which is the Joint Health and Wellbeing Strategy and Delivery Plan. Let me explain, members. We have already seen this. It has already been through this board. We have already agreed it. The issue was that the thought was that it needed to go to council, and it would go through the Health and Wellbeing Board, then go through exec, then go to council. In fact, when we were looking at the terms of reference for the board and delving into the legislation, it was realised that in fact this is a Health and Wellbeing Board decision. The strategy is devolved to the Health and Wellbeing Board. Council does not have a vote on it. We do. So members, you have already read the strategy. I hope you've already read and noted the delivery plan. I am not going to ask Sarah to speak to it. I am simply going to ask Sarah to take any questions, if there are any. Councillor Vickers.
Thank you. Thank you for this report. And obviously, we've heard so much about other issues so far. We know how important meeting, particularly our mental health targets are. My specific question is 4.5. You list different organisations that should be addressing health outcomes for those that are for vulnerable groups. And I didn't see the substance misuse group there, which I think also deals with vulnerable people. And I'm sure there has been a recent meeting of the substance misuse, and this report was mentioned there, but I don't see them listed as a specific group in 4.5 and on 4.6. We've just been talking about the value of having outside opinions and different groups reporting into us, and wondering whether when we're looking at priorities and future meetings, when we're having workshops, whether we'll be extending invitations to other groups to come and sort of talk to us rather than the usual suspects on this committee. Those are just the 2 points I was going to make.
I'll seek to sort of delve onto this, look to the second one, which is that obviously we would really engage with anyone who wanted to talk to us about anything to do with the health and the activities of the Health and Wellbeing Board. But we we are still bottoming out aspects of the delivery plan. So the delivery plan is a movable feast. It's always going to be a movable feast because it needs to reflect the current situation. And indeed, one of the aspects of the delivery plan is the intention in due course. And there's conversations going on within council about what program management software is used in order to make sure that all the different, as I said, there are a whole load of different strands, all sorts of different bodies coming into this. And we need to make sure that they're all working together and they're not conflicting with each other, to make sure that we then know as a board that things are happening, what is happening, and whether we're meeting the targets that we're setting ourselves. But on the first one, Sarah, do you want to just come back on that?
Yeah, no, I can cover that. Thank you, Chair. In terms of the groups that we've highlighted as being responsible for the actions under priority 2 reflect the groups that have been identified under that priority as those that we'll be focusing on in the first instance. So people living with dementia, those who suffered domestic abuse, homelessness, and people with learning disabilities and carers. I think that's all of them. And so that's where the initial work is focusing on. But the intention is that over the course of the strategy, over the next 10 years, that won't necessarily always be the case. And groups may come under that focus and leave that focus depending on where the population need is. So that's the reason why we don't have the substance misuse group as listed under there, because they don't come under one of the main groups who have been identified initially.
Right, thank you. Members, I see no further hands going up, so I'm going to go to ask whether I will propose the report, I will propose the recommendations from the chair. Does that find a seconder in the room? Thank you, Councillor Doherty. Members, indicative vote of everybody to agree the recommendations in the report that you have before you. That looks pretty much everybody. So members in the room, usual hand in front of the camera if you vote for it. Thank you. We have a strategy. Excellent. Well done, Sarah. Full marks to Sarah and everybody else involved. There's been an awful lot of work to get to this point, and there will be an awful lot of work in continuing from this point. Members, we now move to the other piece we have to vote on, which is the Better Care Fund plan. This again is a formal statutory piece which needs to come to the board. So I'm going to ask Maria to talk very briefly, Maria, to the paper so that we can get the vote in. Thank you, Maria.
Thank you, Chair. Right, so I'm here to seek formal approval for the sign-off of the Better Care Fund Plan 21-22. Just to state that the policy framework was not published until October 21, and we were required to submit our plans to NHS England on the 16th of November, and this was done with delegated authority from the Chair. Our plan builds on work that we've done in previous years whilst supporting partners with the recovery of COVID and winter planning. The plan consists of both a narrative and a planning template, which details the income and expenditure and the targets within the plan, and I believe those are in your papers. Just to state that there are 4 national conditions for the plan, one of which that the plan is agreed between Health and Social Care and signed off by the Health and Wellbeing Board. Now, the plan has also been signed off by the accountable body for the CCG, Dr. James Kent. That within the metrics for the plan, there are 4 national metrics, 2 of which have remained the same for this year, and that is the reablement target, and that is the percentage of people at home 91 days after being discharged from hospital, and permanent admissions to care homes, both nursing and residential. There are 2 very different targets for this year. Non-elective admissions has been replaced with avoidable admissions. And just to say that in terms of avoidable admission or non-elective admissions, we as a system in Berkshire West are operating well above the national average. And I think you'll appreciate that last year was a very abnormal year with low numbers of non-elective admissions at 489 per 100,000 population. We've set the target for this year at 618, which is slightly lower than the 1920 figure of 628. And although it is slightly lower, it still supports continued improvement and remains a challenge given the pressures that our colleagues within the NHS are under at the moment. The other target which has changed is on what was delayed transfers of care, which was well known as DTOC. That was suspended in March 2020 due to COVID, and new measures have now been introduced to reflect the new hospital discharge policy. And those targets are about reducing length of stay in hospital, which is measured through the percentage of hospital inpatients who have been in hospital for more than 14 days and 21 days, and to improve the percentage of people discharged to the normal place of residence. Now, both these hospital discharge targets have been agreed with our partners in RBH, and these targets are just for Q3 and Q4, as we are so far through the 2021-22 plan anyway. It is also important to say that we are being asked to stretch our targets by NHS England, and what we have done and what we have agreed with RBH is that we will work on a similar level of performance as we did last year, and this will be a stretch. As we all know, there are particular challenges that we are facing with sourcing care in the care market at the moment, and also we're entering a very difficult winter period with COVID, flu, and we are already seeing pressures within the NHS. I think that's a quick summary of the plan, Graham. I'm happy to take any questions.
And I am looking to see whether there are any. Councillor Stewart.
I just wanted to say thank you to Maria and anybody else involved in pulling this together. That lead time sounds ridiculous, if I'm honest. And why it's like that, I don't know if that's always like it or whether we can push back. Is it? Okay, well, let's find someone to push it back, because this is such an important piece of work. It's about getting funding into the right places that we need for all of the people in, not just in West Berkshire, across Berkshire West. So well done. I will say I've got one added. Thank you for mentioning the piece about DTOC. Absolutely, I think the majority of healthcare professionals will agree at home is the best place for anybody to be. But if you can't fund or source the packages or I don't like calling it packages, but people to come in and look after those people in homes, then we're talking about all sorts of other issues. So I'm glad you mentioned that one. And then just one minor point, because it flagged up to me. So around equipment. And I had a resident come to me and say, I've been trying to give back my walker and my crutches to the Royal Berks. So anybody on the call that might be able to help this. And she had been passed around 3 or 4 different departments because she can't physically get it to them. And in the end, she brought them to me, and we're going to get them in there. So, and there are other people out there that I've seen on social media saying they have kit and what can they do with it. So if anybody can do anything about making that process a little bit easier, that would be fab. I know that's not your bag, Maria, but
Well, actually, NRS, which is a service which is commissioned across the whole of Berkshire for equipment, I'm sure if they contacted them directly, they would come out and pick the equipment up, because we do tend to recycle it within the community.
Okay, I will make that note.
They'll only pick certain things up, Maria. This is a problem.
Oh, okay.
So, but it is something that's worth looking at from a recycling environment and everything else point of view, just sheer cost of throwing things away that could be reused.
Yeah, absolutely.
Can I suggest we take this one offline, guys?
Yes, of course. Sorry, Councillor Bridgman.
No, I do apologise for pushing everyone and rushing everyone, but Councillor Doherty needs to get away, and we need a formal vote. This is rather important, but I do endorse and reflect the thanks to Maria, because the timescale was ludicrous. When I saw it, I thought, what on earth is going on here? Nevertheless, here we are. Members, I propose from the chair. Does it say a second there? Yes, it does. Thank you, Councillor Doherty. Indicative vote. All those in favour? I'm going to take that as unanimous, and I'm going to now look to the members in the room. And that is passed. Thank you. Thank you to get out those formal votes out and allow you to leave. Members, we move on. Thank you. The next item, of course, it's something Councillor Doherty asked for. Now she's going to go away. Ian Woolf is in the room to talk to us about the skills and enterprise partnership. There's just a piece about activity, what's going on. Ian, I look to you to present. Do you need some slides shared, or what are we doing?
No, not necessarily, Chair. I've provided the slides, obviously, in your pack, if you want to look at them, as I'm sure you have. Just to confirm, for anybody that I haven't met before, I'm Ian Walloff, and I chair the Skills and Enterprise Partnership. My day job, of course, is being the principal at the college. So many thanks for inviting me along. Councillor Doherty, obviously, in particular, wanted this item, and unfortunately she's needed to leave. On the work of the Skills and Enterprise Partnership, it's a group, of course, that's been running for quite a number of years. You will have seen the presentation, I believe. And to very briefly summarise, the partnership is now quite a diverse one, with many of the relevant organisations attending and in the room, which is great. The aims, of course, are to support really economic development through the employment and skills development for underrepresented groups. Therefore, we are all about supporting the individual people themselves and indeed supporting employers as well. Particular target groups identified, you've seen in the list: people with physical disabilities, those with mental health problems, those with learning disabilities, those with long-term health conditions, and indeed young people more generally. You've seen and heard reported before the particular projects we've been involved in over the last couple of years, including, first of all, working out who the key target groups are, hoping to run an awareness campaign on employment of people who are furthest from employment. That hasn't happened due to restrictions. The second phase of the Working for a Healthier Tomorrow initiative, it also hasn't happened. And the two things that have happened, the excellent work on the Delivering Life Skills programme through the Education Business Partnership, and our very first Work and Careers Fair delivered in partnership with the college, all of the schools, with the Education Business Partnership, and of course, very importantly, led under the name of our MP through Laura, whose good works have meant that it's received very good publicity and involvement. In terms of our future direction, I have put that in the last slide. We do feel that perhaps we need to divide the work into two parts to continue to do the things which the Skills and Enterprise Partnership has done and will do in the future. And in fact, you will have seen the actions for the Skills and Enterprise Partnership in the delivery plan, which you approved a short while ago for the Health and Wellbeing strategy. And many thanks indeed to Sarah for putting together those key points for the SEP. We have one other thing which we would like to do, which is not currently in the delivery plan, which is to make sure we continue the excellent work on the Delivering Life Skills programme. And as I said, the second part of the work that we probably need to split off is about economic development and skills more generally, rather than related to those who are underrepresented in the workforce. And that's something which we're working with separately with Catherine Mackant, who of course is responsible for looking at economic development. So that's the very quick whistle-stop tour. Conscious you have many important matters to consider today. I'm happy to answer, of course, any questions from the board, and of course to receive your guidance on any other key priorities for the Skills and Enterprise Partnership.
And I thank you for your brevity, Ian. Councillor Vickers.
Thank you very much for that report. Yes, mine was just a question. You do refer in your report to the importance of looking after the mental health of the people you're working with. And I'm just a question about mental health first aid, the course which Berkshire Council sort of has been promoting, and whether this is available to people. I'm not quite sure how it's funded now, I think, but just whether you have any comments on this course and whether you use it within your work. Thank you.
We use it within the college, and in fact we now have a cohort of people who are trained through the mental health first aid qualification and are obviously using those skills with students and others across the college. It's not been a specific part of the delivery plan for the Skills and Enterprise Partnership, but as I'm sure you will have noted, there is indeed an action this time around two things really. One is supporting small businesses to promote mental health in the workplace. So therefore the mental health first aid could be very useful as part of that. And the other, of course, is commissioning services to support people who are themselves in contact with mental health services to get into work. So it's about how employers can use that training to support those employees.
Thank you. Thank you.
And thank you both. So, members, unless there are any other questions for Ian, we move on to the minor matter of changes, national and local and regional, in the healthcare, in the NHS. You know, nothing important there at all. Nikki, you're going to talk to us about where we are at the moment regarding the I love the fact that in one of your slides, or one of the slides here, that we refer to the fact that the phrase ICP is, I think this is now the third iteration of ICP. It just doesn't, it makes life ever so simple when you have to keep using the same phrase for everything else. And now to be a PBP, what fun. Nikki, what do you want to say about where we are?
Yes, this is hard to keep up, isn't it? But thank you very much. So I am just going to present to you an update on our integrated care system, which is an item for discussion with the Health and Wellbeing Board today. I don't know if you want the slides shared, or I can just work from my own copy. It's whatever's easiest for members. But in terms,
Gordon is rushing through his laptop. Bear with him.
Yay! We've got a few more to get through. But I'll just carry on talking. So we'd want to go to slide 3, Gordon, but I'll talk about the context, the purpose, key components, system in place, governance, and then hopefully there's an opportunity for discussion. I do appreciate time is a little bit pressured. But just so context of this presentation, there is a bill that is currently going through Parliament. And I'm sure you can imagine that there is significant guidance coming down almost on a daily basis, which is based on the draft legislation, which we're then taking and reviewing so that we can understand what the implications are and what we need to do to ensure that we're compliant. The aim is that we will be an ICS and it will be a statutory body from April 2022, which is 4 months away. But our understanding and our sort of thinking locally is it will take 12 to 18 months to evolve to fully functioning. I think we just need to bear in mind that we are still working in a pandemic, and that is taking up time in terms of our resources. And also these things need to evolve over time as we work with our partners and our key stakeholders. So as I said, that's the evolution that needs to happen. So today is very much the start of the conversation locally. The ICS has 4 goals. That its purpose is to improve outcomes in population health and healthcare, tackle inequalities in outcome, experience and access, enhance productivity and value for money, and finally help the NHS support broader social and economic development. Those are all goals that you will have heard before, and they were set out in the NHS's long-term plan. The difference now is how we will be organised to deliver those long-term goals. That's what's changing, and that's the purpose of this presentation. So if next slide, please, Gordon, thank you. So the dreaded terminology, and as you rightly said, that is changing again. So if you look at this picture, you'll see that we have Buckinghamshire, Oxfordshire and Berkshire West ICS. So that was our integrated care system. We have an integrated care partnership, which is now Bob. We will have an integrated care board, an ICB, which is the governance. But that's the organisation, and then there's the governance. I see even I'm getting confused. There is the governance, which is the board of the ICB, so board of the Integrated Care Board, that is the governance vehicle, and then there are the place-based partnerships, the PBPs. Berkshire West is one, Oxfordshire is another, and Buckinghamshire is the other, that also operate in this space. And from April 2022, clinical commissioning groups will no longer exist, and all the CCG staff will transfer into the Integrated Care Board. So it is confusing. Next slide, please. Thank you. And here we go, the three recent national changes to terminology. So a health and care partnership that we've used in the past, it is an integrated care partnership. And so ICP is now a system level acronym. Integrated care partnership becomes place-based partnership. So place-based partnership replaces integrated partnership at place level. So we won't talk about the Berkshire West Integrated Care Partnership. It will be the Berkshire West Place-Based Partnership. And the Integrated Care System body leads into the Integrated Care Board. So the teams and resources in the ICB will support both the system and also the place. So they will support Bob, so Buckinghamshire, Oxfordshire, Berkshire West, and place, which is Berkshire West in this context. Next slide, please. So I think it's really important to acknowledge that we are a system made of three places. A number of other ICSs in the southeast, like Sussex and Surrey, have a much greater single focal point, but we are three places, and it's very important to recognise that and acknowledge that. And most care delivery is managed and delivered at place. That's where communities are, that's where people are. And so the intention is that the system would orchestrate the overall strategy and the delegations of accountability and responsibility, that the place, so Berkshire West in this context, would manage the pooled budgets. We've been talking about the Better Care Fund earlier on, which is a pooled fund, and would deliver on urgent and emergency care, long-term conditions and integrated care. So that care that you wrap around the individual, which is your community services, whether they be social care services or healthcare services, mental health services, etc. Localities have that focus to deliver on inequalities. And then there are provider collaboratives who deliver services beyond a place. And I'm already working with a number of provider collaboratives in mental health services, which is an interesting development and a very positive one. And then finally, we need to work together to evolve that system in place. As I mentioned at the start of the presentation, this is an evolving picture. We don't know what it will look like fully at the moment. So next slide, please. So just whilst we sort of thinking about place, and again, some of those changes. So the unified executive of the Integrated Care Partnership will become the place-based partnership, and the place-based partnership will be a formal subcommittee of the Integrated Care Board. So that's just, I think, really worth noting. The place-based partnership will take many of the decisions that sit in the CCG today. So as I said on the last slide, the place will manage pooled budgets. So there'll be decisions around resources, around the capacity that's needed in services to meet demand. And also the expectation is that place-based partnerships will drive changes to enable integrated care. And that might be in cardiology, that might be in musculoskeletal services and pathways. And there will be Integrated Care Board place teams who will support the place-based partnership, just as CCGs have place-based staff today. There will be staff in the future who will support Berkshire West, for example. Next slide, please, Gordon. And this is just it shown diagrammatically. So you see for Berkshire West, we have the HOSC, There will be the Health and Wellbeing Boards, the Place-Based Partnership, which we've talked about, which has a direct link and accountability into the Bob Integrated Care Board. And the Health and Wellbeing Boards have a link into the Bob Integrated Care Partnership. And then I understand that it's been agreed that at some point or in the future there will be a Bob HOSC, and some terms of reference have been developed to support that. So that really gives you, I think if you can see at the bottom of the screen, Place, Bob ICS, and then what the system oversight is. And within that system oversight, we have NHSE and the Care Quality Commission. Next slide, please. In terms of our Integrated Care Board membership, that's set out in the sort of statutory arrangements. So there will be 10 members. There will be a chair, 2 independent non-executive directors, a chief executive of the Integrated Care Board, and James Kent has now been appointed as that chief executive. And then there are 3 partner members, so 1 local authority officer, 1 member from primary care, and 1 NHS provider. And there'll be a finance director, a medical director, and a nursing director. So that is our ICB board membership. And that concludes my presentation. I'm very happy to take questions if time allows, and if I can't answer them, then I will come back with answers for you, just because this is a bit of a changing picture.
Yeah, and I reflect that much of this may be taken away and discussed because this is a ever-changing landscape.
Yeah.
But before I come to members, a question from me, which is just to reflection from me. The discussions ongoing between the political leads within the 3 local authorities within Berkshire West PBP about the relationship between health and wellbeing, the leadership of each authority, health and wellbeing boards, health and wellbeing portfolio holders such as me, and either the PBB on the one hand or the ICS or ICB, or the ICB or the ICP on the other. And reflection that the ICB board has no political relationship. It is a local authority officer who sits there. That within Bob, at first tier, we have 5 local authorities. And there is obviously a concern from West Berkshire that we are, along with Reading and Wokingham, 1/3, as it were, 1/3 of half of a local authority in a certain sense when you compare us to Oxfordshire and Buckinghamshire. And where is our voice? And how does that voice get itself across? Whether it's to, I suspect, the ICP, and whilst you have a very explicit list of members of the ICB, we've got very little on what's in the ICP. And I'm sure that, speaking as a member of 2 as a governor on 2 trusts, I'm sure the trusts want a voice in this new relationship. And where is the voice of the trusts? So I'm just interested as what the conversations that are going on about the ICP are in relation to political and governance voices.
I think that's something that I would need to take back into the back to James Kent as the chief exec.
I'll interrupt you and tell you.
Yeah.
I think we're trying to meet with James, so those conversations will certainly go on, but it won't harm to get at him from 2 angles. And I won't take up any more of that. I will now go to Councillor Vickers.
Thank you, Chair. In fact, you've expressed my main concern is that West Berkshire now becomes quite a small cog in this big wheel. And there has been, during all these negotiations, concern expressed about how this organisation makes everything much more remote and makes local people more disabled in getting their needs met. And as you said yourself, this is very confusing. You actually said that in your presentation. And it's extremely complicated and confusing. And I think it's really important that the councillors, as leaders in their community and people that residents might come to explain things to, or might feel they need to make people aware of these changes, that they need to understand them. And I think this is such an important issue. I think we should have a presentation at full council or a special meeting or a Zoom meeting or something about this, so the councillors can be made aware. And if they remain confused, there's something wrong. Anything that big changes like this, they should be able to be explained in a reasonable, understandable way. And obviously we'll all have ongoing concerns. And if we understand what the changes are and how they affect us locally, we can have our antennae raised and be aware of how to make our local needs met. And I think it's really important that people understand this and that they know where to go and how to keep what's happening, under their radar or above their radar. Thank you.
I think I'll reflect that clearly I'm closer to this than most, but I certainly have been keeping my residents up to speed with the changes, but they don't come in till next April. And really, this is the lead into that process, and the conversations we're having will get to an end point of, I'm absolutely certain, some media and communications out to the extent they haven't. And there's been quite a lot already, but there will be more, no doubt. Go to Councillor Masters next.
Thank you. I'll keep it brief, Chairman. Echo yourself and Councillor Vickers. I think there's the depth of complexity is at times quite mind-boggling, and then it's quite interesting that Nikki refers to how complicated and she's very much in the in the hot seat. And at the heart of all this. So I think there needs to be some work done on how we communicate this, not only to elected officials like ourselves, but professionals down the line. And I echo as well, Councillor Bridgman, because the concerns about has been even more remotely, predisposed to missing out, as and a lot of the issues that we've talked about over the last few years in this very board. Emanate from the fact that we are often forgotten, maybe not explicitly, but that's the perception. So I would say we need to do some work, certainly around that. But thank you, Nikki, for that briefing, and I hope that there's a plain English version.
There is an appendix with the terms at the back. I come from
a military background, which is even more weighed down by 3-letter abbreviations, acronyms, etc. And at times I was lost in the maze that we were going around. So thank you, and I look forward to any further developments.
And no, you put your hand down, Gary. So, come on, Gary. You're muted. Yeah. No, we've lost your voice, Gary. If you can hear us, we can't hear you. No, we'll move on. Okay, as I say, that is a movable feast and will continue, and lots of discussion will continue. Members, the next 1, 2, 3 items are for information. I don't think there is anyone in the room to speak to them. I wasn't necessarily expecting anyone in the room to speak to them. They are all important, but please note, and obviously, if there are questions about any of either the Royal Berks or the North Hampshire building plans, and I missed a meeting of an informal meeting of the governing body of Royal Berks, so I would have heard some stuff this morning had I not been chairing this. We will get further updates as time goes on. And so far as the pharmaceutical needs assessment is concerned, that is we decided that was a paper that you could read. I don't think it needed discussion. It is, I think, self-explanatory, but please take any questions up with Matt Pearce. Councillor Vickers.
Thank you, Chair. Just a general point that I'm hearing from council colleagues that they are not really aware of the changes and the plans for our new hospitals, and that they feel that this information should be disseminated more widely among councillors, and they're wondering about the level of consultation that's gone on so far, because some are coming forward with quite specific issues and they're saying that they haven't had an opportunity to put their opinions forward. Is this again something that we should be making more of an effort to make sure that everybody's informed about?
I can really only speak to the Royal Berks programme, given that I'm a governor, from memory, there is a microsite devoted to the whole project, available for anyone to go and have a look at. But if members have specific questions about the proposals, and as I say, I've asked the chairman of the Royal Berks just privately, given that I wasn't at the meeting this morning, for a briefing note. I will follow that up and see if I can get a briefing note, because I think it's just as easy to read this and go on the microsite and have a look. A briefing note for our members generally, so that everyone is aware of what's going on. And I'll pass the same question on to North Hampshire and the Hampshire Together update. So members, everything else being for information, unless anyone has any particular points, just check. I don't believe we have any members' questions, Gordon.
No, we don't.
So that is an item we can move on from. You have the forward plan in your pack. You also should be aware of future meeting dates, and that future meeting dates are 17th of Feb next year and 19th of May next year within this municipal year. Although I'm hesitant to think that the 19th of May is within the municipal year, but never mind. The other thing is the Health and Wellbeing Conference. Work is being done on that. That should be in your diaries for the 21st of January. It will be virtual. And as I say, work is being done, but it is very much to do with the strategy and the delivery plan around the strategy, and discussions around those 5 flavours of the delivery plan and of the strategy. So members, unless there is anything specific anyone wants to raise, I will call the meeting to a close. I see no hands, so I will do that. Please stay in the room until we have stopped streaming.